If you've already had experience with Straightwire, whether you've been a fast braces provider, a 6-month smiles provider, power props provider, and or maybe you've taken progressive Gerety and some of the other courses out there and you've done a few cases at least, and you know everything in this list you're comfortable with, then you can go ahead and instead we'll place you, and we'll check with you before and see what level you're at. We'll place you in IDB 201, which is Dr. Rishi's course. Rishi, tell us a little bit about that and how this hands-on course is a little bit different from anything else that's out there.
Sure, so this is the actual bread and butter of indirect bonding. This will be where how we teach you how to take a model, a patient's model, and actually put the brackets on that model, how to make your own indirect bonding trays in your own office. You can teach your staff how to do it as well. That's why we encourage staff to come as well to learn this technique. And then we'll take we'll transfer the brackets from the actual model to the jig, and we'll transfer the jig to the patient's actual mouth. So we'll be doing a hands-on course. If you want to bring your assistant and put braces on your assistant, fantastic, even better. You can see how it actually works in your hands. If not, we have other ways of doing the actual hands-on chairside technique of putting braces on your patient. When we've done this class before in the past, some doctors have actually brought their patients' cases with them, and we've done the whole setup for them while they were here. So when they go back to their office the following week, they already have the trays ready to go to deliver or install, if you will, the braces on their patient. Or if you want to bring your assistant and put braces on her, or even fly your patient here, who knows, if you want to do that, we can do that in-office course here, put the braces on the same day. You'll be the provider, you'll be the doctor, and it'll be really straightforward. Okay.
So Dr. Rishi, I heard that one of the special ROIs of this IDB 201 class is that you'll actually get a free case, an actual orthodontic case to take home, or you can bring out your assistant and strap them up and you get a free case in office. You're actually going to be the doctor, you're the doctor if you're a licensed doctor, and you'll be bonding your patient or your assistant in the office. We'll give you a free case, we'll do the indirect bonding, you'll do it there, you'll learn how to do it. Or if you want to take one home, if your patient can't come, you can do the setup and make the tray there, and it will include one full setup. So Rishi, tell us a little bit more about how that works.
That's correct. It's a $500 value of indirect bonding trays, upper and lower, so it's a full comprehensive case. If you want to bring your patient's model from your office, you'd be happy to bring that models with you. We'll teach you how to actually put the brackets on. We'll include the brackets as well. So when you leave the class, you'll have a full indirect bonding trays for upper and lower for your patients to deliver the following week when you return to the office. Otherwise, we'd be happy to include a case here if you want to bring your patient or if you want to bring your staff member to put the braces on, so you learn chairside techniques of how the whole process works step by step from start to finish, which is a great value because you understand the whole process from start to finish, from taking the impressions, from making the indirect bonding trays, from actually the chairside delivering the brackets on the patient, to how to manage the communication, the verbiage that we use specifically for our office for patient management and patient expectations.
And actually, I'm going to say that's more than a $500 value, Rishi, because a lot of other companies are charging $800 to $900 for one IDB case. So it's basically like that's a very generous offer that you're giving, a free case, complete setup. And like we said, you can take one case and take it all the way through from start to finish in terms of, you know, working the case up, diagnostics, taking records. We can do that all there. So that's pretty incredible. Thank you for offering that. So again, just to clarify, there's an IDB 101 and an IDB 201 case going at the same time. The IDB 201 case will be happening in the lab and in the actual clinical portion of Dr. Rishi's office. IDB 101 will be in the actual classroom part of Dr. Rishi's office. These are happening the same time. So if you have a lot of experience already with Straightwire, you'll move on to 201. If you're kind of new at it, I strongly recommend you take 101 first. And then you can take 201 at a different time.